Unfortunately, many of us will face a medical emergency at some point. But in some medical emergencies, patients are unable to communicate with others and make decisions. When this happens, doctors and loved ones may not know what treatments you want. So planning ahead helps you receive the care you want if a medical emergency arises. Completing a living will is a good way to plan ahead. A living will is a type of advance directive or a written document that indicates what type of medical treatment you want if you're unable to communicate. Because emergencies can arise for anyone, it is recommended that everyone complete a living will. However, living wills are even more important for people with a serious illness. The first step toward completing a living will is to think about the care you want in a medical emergency by asking yourself a couple of questions. First, under what conditions would you want to be kept on machines to keep you alive, referred to as life support? For instance, would you want to be kept on life support if you were in a coma or unlikely to recover? Second, what types of life support, if any, would you want? For instance, if you were unable to eat or breathe on your own, would you like to be put on a feeding tube or a breathing machine to help your body perform these functions? Talk to your doctor to learn more about the pros and cons of receiving life support treatments both when you're likely or unlikely to recover from your illness or injury. Then, share your decision with your loved ones. Once you have talked with your doctor and loved ones, be sure to fill out a living will document and store it in an accessible location. Living wills are easy to complete and available at your doctor's office or online. They can be updated at any time should your preferences change. Completing a living will leads to the